A topic which requires a lot of discussion, but is not being the attention is not being given a lot for this topic. That's menopause. We do identify a lot of women who have attained menopause. A lot of Indian women do not come out and say that they are either feeling tired, stressed, anxious, or hot flushes. It's very, very rare that I see women beyond 50 years or 55 years visiting the clinic with these symptoms. So it definitely needs to be addressed, and I'm glad that one of our members in Telegram group brought out this topic. So basically, when you say menopause, it's a period where you're anywhere beyond 45 years or 50 years of age, where you've stopped having your periods for more than a year. 1 year. So that's when you we call you as that you we term a patient who's attained as menopause. So what you need to understand about menopause is that anytime after menopause, if you get bleeding, even a few drops or even any type of bleeding 1 day or 2 days, or with drops or even blood flow amounting to use of pads, is extremely important that you need to alert your gynecologist. That's 1. 2. Hot flushes, anxiety, stress, depression is extremely common during your menopause, and actually we have almost 75, the research says 75 to 80% of them who have attained menopause go through these symptoms within the first 6 months to 1 year after menopause, and it lasts for around 30 to 40% of them will have these symptoms lasting for almost 5 years, after which it will reduce automatically, and 10% of them can have it even up till 10 years post-menopause. So it's very, very common that a woman who has gone through menopause faces a lot of changes, which is definitely going to affect her quality of life. What I want you to understand about this, why does it all happen, and what can we do to at least reduce the anxiety levels or stress levels of women who go through that phase. The hot flushes, the temperature changes, the excessive sweating, anxiousness are all because of hormones which are acting on the brain. The two hormones are serotonin and norepinephrine. These two hormones actually regulates, they are called thermoregulators, and they work on the brain, and and there are plenty of changes which happens post-menopause, and the effect of it is what is seen as stress and anxiety and hot flushes. So what can we do to reduce the severity or reduce the frequency of these hot flushes? There are articles and research which talk about soy extracts, herbs, herbal plants, and yeah, there are papers, but there is no clinically proven significant whether those will reduce the hot flushes or the anxiety levels. So what we can do about it? Yes, we do have medications. Do not hesitate to consult your gynecologist. We do have medications which could act upon these hormones and thermoregulators, where we could definitely reduce the symptoms of anxiety, the anxiety spells, the anxiety attacks, the hot flushes. The frequency can be reduced with medications like gabapentin, and we have our serotonin reuptake inhibitor medicines, which will directly act on these brain cells, the area in the brain, and it will reduce the symptoms of the patients. So do not hesitate to talk to your gynecologist. 1. But what can you do to prevent or reduce the severity is, 1, the most effective method is for physical activity. Let it be like walking or whatever you're comfortable. Yoga is very good. 3, meditation. Meditation or relaxing or calming your mind is extremely important to reduce your stress levels. And also, why do we have to do all that? Because the hormone changes which happen post-menopause is very huge in cases talking about hormones like estrogen and progesterone, because estrogen is the hormone which protects the woman's heart and the bones throughout her life, and very soon after menopause these hormones level drops, and when this hormone levels drop, what happens is then the protection towards the heart, the bone density, everything reduces drastically. So you are more prone for cancer breast, endometrial cancer, bone density loss like as in osteoporosis, and also you're also prone for a lot of heart attacks or heart related issues. So it's extremely important that you do have a bout of supplementation of calcium, vitamin D. You consult either an orthopedician or a gynecologist for a supplementation of vitamin D, calcium tablets, and also if the hot flushes and the stress or anxiety spells are high in number, please contact them so that we can prescribe you medications which have gone through clinical trials and research trials and have definitely been proven effective to control your symptoms post-menopause. And remember, all these symptoms may maximum last for a year or two, and it's going to drastically reduce over a period of 5 to 10 years. So this is not going to be there for lifelong. So the immediate post-menopausal period is the time we need to address. So contact your gynecologist on symptoms if they are beyond your ability to manage, and we'll be more than happy to help you out with them.